I like to think of primary care sports medicine as that first line when it comes to musculoskeletal care. And as primary care docs, we tend to take a holistic approach to our patients, meaning if it's important to your treatment plan, we'll discuss exercise, diet, and overall physical and mental well-being. Our ultimate goal as primary care doctors is to get you back to where you need to be, whatever that goal may be, with a non-surgical approach that's as minimally invasive but maximally therapeutic. Primary care sports medicine is a pretty unique medical specialty. We have training in both primary care as well as non-surgical orthopedic care. We're trained in the prevention, the diagnosis, treatment, and rehabilitation of musculoskeletal injuries. Sports medicine is a bit of a misnomer. I think a lot of people think that I just see athletes or I just see people injured playing sports, and that's not necessarily true. I do see my fair share of athletes and people injured while playing sports, but I also see people who are just injured in their day-to-day lives, people who are having the chronic arthritic pains. And that brings me a whole gamut of patient population, meaning ages from children all the way to older adults. Shared decision-making is very important when it comes to my clinical practice. I think it's important to have that communication between myself and the patient, to hear from them about previous injuries, what's their ultimate goal and timeline in getting back to things. You can have two patients with the exact same diagnosis. One patient wants to get back in 4 weeks for a college showcase, and another person wants to get back in 6 months to play with their grandchild. And both very valid reasons and timelines, but they're gonna lead to different treatment options. And hearing from a patient what they want and when they wanna get to where they wanna be is very important to hear. One of the great things about our primary care clinics is that we can offer diagnostic ultrasound, and that's just using a diagnostic probe bedside in real time to look at that area of concern. And a lot of times we're able to come out with a diagnosis without you having to go get additional imaging, and that can get you started on a treatment path quickly. In addition to this, we offer different types of injections. A lot of times it used to be thought we only have steroids. Well, we can still do steroid injections, but there's things like hyaluronic acid or gel injections, as well as things like platelet-rich plasma or PRP. Collaboration is extremely important in the realm of sports medicine. Daily, I'm speaking with orthopedic surgeons, physical therapists, and athletic trainers. With my physical therapist, if I'm sending someone to therapy, it's great to have communication back and forth about what's best for the patient to get them better fast. If a patient needs to go to the surgery, I can get in contact with an orthopedic surgeon and get that done as soon as possible. What I love most about primary care sports medicine is being able to build longitudinal relationships with my patients. Taking physical activity or exercise away from someone can be pretty debilitating for not only their physical health, but also their mental health. And being able to go from step A, where we're going through diagnosis together, treatment plans, and going through rehabilitation, and getting to see that patient back when they're feeling better, back to their baseline, is truly an enjoyable experience. Another thing that I love about my job is being able to act as a team physician for Goucher College and Morgan State University. I find a lot of joy in being able to work with the college athletes and getting them back onto the field performing to their best abilities. MedStar Orthopedics and Sports Medicine is a real powerhouse in the region. We've got the technology, education, resources, and the specialists that get you the care that you need and deserve.